This is a short video about the Manchester Musculoskeletal Screening Tool and instructions on how to complete it. If you'd like a copy of the tool, please contact the Manchester Adult CF Centre, either Nicola Hodgson or Julia Taylor for a copy. Hi, my name's Julia Taylor.
I'm Nicola Hodgson.
And we're the MSK physios at the Manchester Adult CF Centre. This is a short video just to tell you a little bit about the Manchester Musculoskeletal Screening Tool. This is a tool that we use on our unit. We've been using it for about 10 years and we've made some recent changes which we're going to let you know about as we're talking. So the tool really should be very quick to fill out. It's just asking about pain, posture and incontinence problems and looking at a quick movement screen of the thoracic spine. It's a screening tool, it's not an assessment tool. We don't tend to fill out on our unit, we tend to let the physios who work at annual review tend to fill it out and then they refer to us if there's any problems. They're yes-no answers and the movement screen is a yes-no answer as well. So they either got full movement or they haven't got full movement, they've either got pain or they haven't got pain. So any yes answers tend to come, the patient tend to come to us. So question 1 is, do you have any episodes of pain?
If the patient answers yes, we would like you to fill out the McGill pain questionnaire, which is attached to the screening tool.
And then the second question is, do you have any episodes of leaking urine or an urgent or frequent need to pass water? It can be quite a difficult question to ask this, but the more you ask it with patients, the easier it becomes. And it's a really important question to ask patients.
If the patient scores yes, please fill out the ICIQ questionnaire, which is attached to the screening tool. It would be also useful that even if patients answer no to this question, it can be quite important to get them to fill it out, and it can unravel some issues.
And then question 3 is, do you have any concerns about your posture? And this is the patient's opportunity to say yes or no. We know that often patients do have issues that they'd like to talk about, but they've never really been asked about them in the past. Question 4 is, what is the cause of pain? And it's just whether or not you can make an assessment to see whether it's sort of a musculoskeletal problem or not. If you're unsure, it doesn't matter, but it's about where you're sort of referring that patient on. If it's not an MSK pain problem, then you should be referring that patient on to somebody else in terms of, talked about abdominal pain or any other pain that isn't MSK related.
And it's useful to document where the patient is experiencing the pain on the body chart that's on the questionnaire.
And then the questions 5, 6, 7 and 8 are the movement screen. So that's looking at the patient's thoracic movement. So Nicola has done a brief demonstration with Vicky to demonstrate these questions. So once the screening tool's been completed, you then need to score it, and there's a section on the front sheet where you put your ticks or crosses. This is the section which we made a slight change to, so there's now shaded boxes. If the ticks are all in the shaded boxes, the patient then passes the tool. Because we've made a slight change to some of the wording, overall the tool is easier to use and makes sense a little bit more, but there is a slight change to it. So the patient, all the shaded boxes are ticked, and the patient will pass. And you can use the screening matrix on the last page to sort of inform you of where the patient needs to be referred on to.
Okay. If the patient has got all the ticks in the shaded area, but you are still concerned about the patient, be happy to still refer the patient on to the relevant service. So question 5 asks, is there a fixed thoracic kyphosis? So you need to observe the patient from the side to see whether they have an increased curve in this area. And then ask your patient to sit down. And then again, you're observing whether they have an increased curve in this area. If your patient happens to sit in a slumped position, what you could ask is, can you sit up any higher? And just see whether they're able to correct this curvature. So question 6 asks, is the patient able to lift both arms up straight level with the ears? So ask your patient to raise both arms up. Okay, and Vicky does this really nicely her arms across her ears. If a patient is unable to do this, you may find that they have an increased curve here and they're unable to get their arms level with their ears. You could ask the patient, can you sit up any more? If they do this one, caution needs to be applied that if they do this with the lumbar spine, they're not changing anything here. So we're looking at that they're able to increase the movement here and not at the lower back. So question 7 asks, with the arms across the chest, is the patient able to rotate 45 degrees to the left and the right? You'd observe the patient from behind. So just cross your hands across your chest, and then can you rotate one way and back to the middle, and rotate the other way and back to the middle, and rest. So question 8 asks, with the arms on top of the head, is the patient able to lean 30 degrees to the left and the right? So ask your patient to place their hands on top of the head and ask them, can they lean to one side? And try and encourage the patient to get the movement from here. And then lean the other way and back to the middle and rest.
Thanks very much for watching. If you have any further questions, please don't hesitate to email or phone Nicola and myself at the Manchester unit. Always happy to chat about this. Thanks very much.